Hi, and welcome to the pre-operative class by Tonya Anderson Morgan, registered dietitian at LifeBridge Health. At this time, you probably are about to get a surgery date or already have one. Use the remainder of this time to make sure you are well prepared for surgery. Being well prepared is the absolute key on optimizing your success and ensuring a smooth transition. Here is a short list of the items you definitely want to have on hand by the time you have surgery. Water. Some people prefer to have bottled water, and that's okay, or you can use your own filtered water and refillable bottle. Fluids also include low-calorie drinks that have up to 10 calories per serving. Protein water. Protein water is a great way to transition from fluids into the protein stage, as well as if you're having tolerance problems with the protein shakes, we can also have protein water. Vitamins. You would have gone through with your vitamin worksheet the brand of vitamins you're going to buy and how to use them. Make sure you have this already on hand by the time of surgery. Broths. Broths are going to come in handy during the clear liquid stage immediately post-op. Have at least two flavors available. Juice. You want 100% clear juices only. You will be using this during the juice party in those first few days just after surgery. And then, of course, your protein shakes or your protein powder. You will be mixing some of your protein shakes yourself, so powder is definitely useful. And then you are welcome to have a variety of flavors of ready-made protein shakes. Timing with your different supplementation is important. At this time, it is likely that you are about to have a surgery date if you do not already have one. So once you have your surgery date, make sure we stop all multivitamins. As long as we have our date, this is easier. Or if you predict you've been speaking with a pre-op nurse and you predict that your surgery will be soon, make sure to stop all these vitamins within 2 weeks before that surgery. Are there things you want to stop maybe right now since you're about to have surgery in a couple weeks or so? You could also use the last month of your weight loss documentation as a marker of when to stop all of these items as they are not medically necessary. So your fish oil, glucosamine, elderberry, any kind of Goalies, additional vitamin E, even vitamin A, you might be taking even if it was prescribed. So let's pause on those items. Once you've had surgery and you are 2 months post-op, you're welcome to resume your herbal supplementation regimen, though you will have a bariatric vitamin regimen that must be taken as directed. So these items are secondary and not necessarily primary, but you're welcome to reintroduce them at the 2-month post-op mark. 1 month before surgery, you're also going to stop taking any type of NSAIDs or aspirin. So these go together. Your herbal supplements and your aspirin, you're going to stop all those things 1 month before surgery. For those of you having the sleeve, the more popular option of the surgery, if you recall, a large part of your stomach is being removed. Because the stomach has a lot of functions, especially with digestion and breaking up our food, so does that function go with it. So we cannot expect 25% of the stomach to perform the same work 100% of the stomach would have done. And for this reason, we need vitamins to make sure that we are filling in any gaps of micronutrients that we need, and your micronutrients will be your vitamins and your minerals. Because this change is permanent, we're going to need vitamins forever, forever and ever and ever. Ever, ever, okay? And this is what we need to do for optimum health. We are now at a reduced ability to eat enough whole food because your little pouch can't hold as much as it used to. So there's going to be a shortage of nutrients that is available to us simply because we can't eat it all anymore. Also, there's less stomach acid being produced since we only have a portion, a little portion, 25% of the stomach remains, and that too has a job. It breaks down the food in the tiniest bit of part, so when it goes to the intestine, it can be further down, further broken down and absorbed. So this is why we supplement with vitamins. And what if we do not get in the vitamins that we need from our multivitamin regimen? Well, um, a vitamin deficiency is defined by the body just not getting enough of it. And as we saw before, we just can't fit the same amount of food as we used to. Now, what causes these deficiencies, aside from taking in enough food, people forget to take their multivitamins, their calcium citrate. People just forget with time. If you remember taking a multivitamin maybe some time ago and maybe you had a change in your job or your routine, then it's easy for someone to deviate from that routine of taking their vitamins regularly. However, after the surgery, you want to make sure you do what you can so that this does not happen. What we can do is set alarms in our phone to last forever for annual alarms, daily alarms, weekly alarms. And you can name that alarm to ensure that you are taking your vitamins. Some people just don't take them at all. Some people forget that you take them forever, and once maybe a year has passed and they're no longer seeing the clinical team as regular as they used to during the preparation for the surgery, and they feel fine, then they no longer take the vitamins. Let's not do that because some deficiencies are much harder to correct. And we don't always feel when something is not right with us. We cannot rely on how we feel to ensure that we are healthy. Another thing is some people take them all at once to save time. And our bodies just do not work that way. Our bodies prefer that we get our nutrition in small amounts and spread across the day and every day as a regular, fresh source of nutrition. That is just how our body prefers it. So taking all of them at one time or taking a week's worth only on one day will not benefit us the same way. Let's have a look here at some of the possible side effects from specific vitamin deficiencies. Calcium is very important and it's going to be really important as part of your vitamin regimen. So important that you usually get this by itself. We all know calcium is important for strong bones. If we're not getting enough of it every day, eventually our bones become weaker and they become porous. They are like sponge. Bones are also known as spongy tissue because aside from the smooth part you might have seen in a skeleton from the outside, if you were to break it open, it's almost kind of hollow, like a sponge. There's lots of spaces in between there. And those spaces become bigger and bigger, and the threading in between them become thinner and thinner as we do not get enough calcium. Iron is something else that we definitely need, and when we don't get enough, we tend to feel very fatigued and tired, and sometimes even lose hair because of anemia. Folate. Folate can also lead to anemia. This is also known as vitamin B9. Thiamine. Thiamine is also vitamin B1, and this is super important in our neurological function. We can learn new things. We can remember things that we have just learned and a long time ago. And it also plays a really important role in making sure that the foods you do eat are converted into energy so that our body can really, really use that energy, that fuel source. And then vitamin A. If we're not getting enough vitamin A, we can literally go blind. So it can start as having foggy vision, not seeing very clearly, words and objects becoming less sharp. They're fuzzy and blurry. And that's when you have a mild deficiency. And that is correctable if we catch it in time. However, if your deficiency is too far gone for too long a time, you've been without adequate vitamin A, then you may just go over the edge. We may not be able to correct it, and you can just continue to lose your sight until you are blind. This can also affect a fetus if you are pregnant. Vitamin B12 is also important to keeping us energized. So we may be fatigued, we can possibly become anemic, and we can have some nerve disorders. So this can present its way in different ways, and this will be further analyzed once your labs come back, but it can present in different ways. Vitamin D, well, we know we need vitamin D, especially because of where we live geographically. We are in North America and we don't get nice amounts of sunshine all through the year. So we want to make sure we're getting enough on a regular basis. Now, does that mean you have to take more than what's recommended during the winter time? No, because it's going to be the exact amount that we need daily every day throughout all of the seasons. Now, if you are prescribed additional vitamin D, then you are invited to take the prescribed amount. Your prescription of any vitamin or drug will always supersede or come first over any other supplements that you take. So this is just letting you know you're going to get to the number soon where you will see the minimum amounts that you need. Just these adequate intakes are going to be what you need as a minimum value. But if you yourself needs additional, you are welcome to take that additional on top of this regimen. Okay. So vitamin D is also important to keep your liver and kidneys all together. Because if we're low, these two organs are extremely important. This is your detoxing agent right here, and this is your cleansing agent right here. So your liver is your detox machine, and your kidney is your cleansing machine that cleanses your blood. You do not need a separate item for that. You just need to make sure those two organs are working well. And it also works in tandem to making sure that your bones are nice and hard. Vitamin E is very efficient in making sure that you're healing properly when you're coming from your surgery, and also helps with your brain and nerve development. So we don't want any issues in our brain, of course, and we don't want anemia. Vitamin K. We might have heard vitamin K is great for healing or clotting. So if we don't have enough, then the blood is not going to clot very well. And every little bump you get, you're going to see some red and blue marks, and that'll be easy bruising. That could be a sign of poor vitamin K. So we want to keep that going. Vitamin K also helps keeps our bones together. So you see how many times we've mentioned bones here. That's outside of calcium. It's just to show you that our bodies are so beautifully complex. All of these things matter, they work together. And of course, heart disease, we need vitamin K to make sure our heart is well. Zinc helps with your nails and keeping your hair together. It's one of the more common minerals found in your hair. So if you see your nails are chipping, you might have a zinc deficiency. Those are some ways we can determine that. You're taking your vitamins, all of your vitamins, they're called supplements. Supplements are just making sure that you get your nutrition in addition to whole food. That's what the concept of supplements mean. For your vitamins and minerals, during your first 3 months of surgery, they must absolutely be either soft chews, a hard chews, or liquid for all surgeries, whether you have a band or sleeve or a bypass. They must be one of these. Do not engage in gummies. Do not engage in patches. These items are not yet well researched for the bariatric community, and we prefer to work with items we know that will certainly work for you. I will not take such a risk on experimental products at this time because there's only one peri-op period. Once you've had surgery, the risk is there. So let's make sure we minimize any type of drama, any type of deficiencies, because it's really important during that time while you're healing, and only use what we know for sure will work. It is strongly suggested that you stick to the bariatric brands for the first 3 to 6 months of your surgery. They are already formulated in such a way that most of them have enough of what you need. They taste well, and they're definitely going to come in one of these three forms, and some brands even have all three. So the normal pills that you would see, like a hard pill to swallow from regular vitamins, they have a high risk of getting stuck. The gel capsules can be stuck and the hard pills can be stuck, and it's going to be very uncomfortable for you. If you get a lap band within 5 weeks, not within, after 5 weeks, after surgery, post-op, then you can resume taking regular pills in its place, but we still want to make sure we get enough of the nutrition. But if you get a sleeve, then you must take bariatric brands for the first 3 months. And if you do a bypass, then you will wait 6 months before you introduce a non-bariatric brand of vitamins, and that when you can go back to a capsule. But before this time, choose soft chews, hard chews, and liquid. When you are experimenting with other hard capsules, say for your multivitamin, you will take 2 of those servings, whatever that serving is. Some servings is 1 per day, some servings maybe 2 per day. You're going to take 2 servings of the regular multivitamin once you are at that 3 month or 6 month post-op mark. Okay? That multivitamin should be either USP or GMP approved. It can also be Bayer approved. One a day is Bayer approved, but these are the major independent organization that's going to verify that what's in the bottle is actually on the label. Vitamins are going to be a bit of a cost, anywhere from $50 to $80 a month. However, there's constantly new products that are becoming more and more affordable. And then think about it as you're not spending this money on food anymore, so you're eating a lot less. So this money is just being redirected from what you used to eat, we're just taking it a different way. Okay? In your binder and likely in your email for the invitation to this class, you have received soft and hard copies of your multivitamin daily needs. So you have a sheet that's entitled the same way, or daily multivitamin needs. It gives you a list of all the different vitamins we need, vitamins and minerals, and how much we definitely want to get. Some of them have ranges and some of them just have a minimum. So for example, multivitamins, you want to make sure first and foremost, and this is on top because it tends to be low in a lot of the bariatric multivitamins. So you want to make sure if you're supposed to take 2 or 3 a day or 1 or 2 a day, when you add up all of those servings in a day, you are getting a minimum of 12 milligrams of thiamine. So if your multivitamin says 1 serving has 6 milligrams, then you take 2 servings per day. And then now that means you get 12 milligrams of thiamine. However, if 1 serving has 3 milligrams, and 1 serving is 2 tablets, then we need to take 4 servings to make sure we're getting 12 milligrams of thiamine. And those 4 servings would be total to 4 by 2, which will be 8 tablets, or the hard chews or the soft chews. Okay, so let's pay attention to serving size and how many servings we need to make sure we're meeting our needs. So at the end of the day, when you add up your regimen, I'm taking X amount of multivitamin, I'm taking X amount of calcium. Let's make sure the folic acid or the folate falls between these numbers, 400 to 800 micrograms, your B12, 350 to 500, and so forth and so forth. So you do not need to get much more than the maximums listed here. For example, if your B12 is maybe 550, that's not a problem. Once we try to stay close to the range as possible, then we do your lab work, we will know if an adjustment needs to be made. But for now, try to stay within these guidelines. Your vitamin D, it can either be in your multivitamin, soft or hard chew, or it may be included in your calcium citrate because those two things go so well together. So you do not necessarily need it separately. You might find this in either your multivitamin or your calcium citrate. And just to continue the list, we have vitamin E, K, copper, zinc. And the number of servings, as mentioned before, will depend on the brand of vitamin and the specific type. Calcium citrate. You will be buying calcium citrate separately. So normally you would have a multivitamin that's going to include all those things we covered just now. And then you have a calcium citrate. Those are the very two basic things you're definitely going to have after surgery. Forever and ever and ever, always going to need a minimum of 1,200 milligrams of calcium citrate and about a maximum of 1,500. However, if you are deficient in any of these nutrients, we would likely put you on a corrective path where we may elevate the number so that we can sort of catch up. This is not something for you to determine. You will see either Rebecca, the nurse practitioner, or the dietitian, or myself to help you with this correction. But this is what you would take normally for a given day. How do we get this? Most of them are going to come in 500 milligram chews. So if you get a 5, then we take it 3 times a day. 5 by 3 is 15, plus those zeros, 1,500. Or most of them also comes, or many of them, come in 600 milligram chews. So then we take only 2 a day. 6 by 2 is 12. Bring the 2 zeros, 1,200. 1,200 to 1,500. Well, what if your calcium has 400? Then 4 times 3 is 12, and we take 3 of those as well. So we just want to make sure we take enough to add up to get this range over here. Now, the fun thing about calcium citrate is you don't need to take it with a meal. You can have it with or without meal. And for your multivitamin, it's preferred to take it with a meal, but some of them would say on the bottle you can have it with or without meals. Now, if you have to take 3 or 2 chews, you want to take them separately. Remember before I mentioned our body prefers our nutrition to be spread out across the day. Now, do I mean take one at 9 a.m. and then the second one at 10 p.m.? That's possible and that's okay. But do I mean take it at 9 a.m. and then 10 a.m.? That's only 1 hour apart. That's not spread out enough. So let's try to just break it up in the day, either morning and evening, morning, early afternoon. Just give it somehow we can try to split up the day in half best we can. Now, when you're getting your calcium citrate, it needs to say calcium citrate on the label. It may be called different names at the front, like caltrate, calcitrate, and different things that might look like calcium citrate, but you need to go to the back and make sure you see calcium citrate exclusively. Sometimes you may see calcium carbonate. This is a different form of calcium and it's going to work different in our body. And this is the version we do not want. So your calcium carbonate, we're only going to absorb about 8% of that calcium compared to almost 60% of the calcium citrate that we prefer that you take. And then the calcium carbonate can also lead to chronic nausea. You can feel a whole mess. You can get gas pain, and then it promotes the growth of kidney stones regardless of how much water you drink. You have to drink a whole lot more water. Okay, so let's make sure we get the right brand. Don't just look for, not brand, but the right type. Don't just look for calcium now. There's other calciums out there, but these are the most two popular ones. We want to make sure we get the citrate. And last but not least, you want to take your calcium citrate at least 2 hours apart from your iron. And that brings us to iron. Generally speaking, we need about 45 to 60 milligrams of elemental iron for any surgery that we're getting. However, if you are a non-menstruating woman and you're getting a lap band, that's the only exception that you get about 18 milligrams. Now, there's different types of iron, just like there are different types of calcium, right? These are minerals and they come in different just different kinds. So let's make sure when we're getting our iron, it says either ferrous gluconate or ferrous fumarate. Now, sometimes we get a multivitamin with iron, but it is advised to have your iron separate as soon as you're done with surgery, the first couple of months, as iron tends to contribute to constipation. So let's keep our multivitamins separate without iron, and we can have our iron separate. And depending on the nature of your labs and your clinical presentation, you can either hold it or Dr. will let you know if you should continue to take it immediately after surgery. But this is how much you want to have on hand, okay? 45 to 60 milligrams, and it's usually going to be just that amount in one soft dissolvable chew. You're going to make sure and take it at least 2 hours, bare minimum, apart from any kind of supplement, any type of calcium, as well as any kind of calcium supplement. So milk is high in calcium, don't take it with milk. So is tea, coffee, and antacids tends to be high in caffeine. So we're not going to take it with caffeinated items, and we're not going to take it with high calcium items. So usually most patients might take it at the very end of the night if they're taking iron, and that way you've already had your vitamins, you've already had your calcium earlier in the evening or earlier in the day. Now, if we have too much caffeine, it also inhibits you absorbing enough iron from your body, and it kind of leaches. So this is why we also have a limit on how much caffeine you should be having from day to day after surgery. Once you're out of the peri-op period at 3 months, try to cap it at 16 ounces, because too much can lower your iron stores. All right, so some bariatric brands, there's a lot of them, and by the time you see this, there might be 10 more that may have popped up somewhere. However, any one of these will work. We just need to make sure, yes, it's bariatric friendly, and we have that daily vitamin E sheet to make sure that the individual vitamins and minerals requirements are being met. So Unduri is part of a purity. Unduri tends to be more the shakes, protein shakes and the bars side of the company, and the Purity tends to be the vitamin mineral side of the company. These items, this brand is very affordable, so it's pretty cost effective if that's a factor for you. The taste is okay. It's not the greatest taste. It doesn't taste like Starbucks or Starburst, I meant, but it's okay for most people. Bariatric Advantage, it just might be one of the big three. So Bariatric Advantage has been along a long time, so is Celebrate and Bariatric Fusion. So these tend to be really big brands. You don't have to go with the really big brands. They tend to be a little more costly. Celebrate is cost effective. So the simpler brands, Unduri and Celebrate tends to be more cost effective. And of course, you get what you pay for. So you may not have as much variety with flavors, but it's tolerable. It's good. It's tolerable for most people. And then you may have the hard chews tend to be more cost effective than the soft chews. Bariatric Fusion is a little bit higher on the cost scale. They taste really good, almost like candy, in my opinion. You may get some samples before surgery. So some of these things you might get some samples. So you can keep the wrapper of the ones that you like and make note. So you're going to get your sample goodie bag before surgery. Make sure and ask for it at the front desk. For those of you who have a need for vitamin B12, you have a prescription recommended to have vitamin B12, then you can apply for the nasal cobalt free vitamin application. So you would have gotten one of these in your email at some point. It's going to be in a bunch of other emails with your other attachments, maybe in your welcome email. But at the end, when you see the pre-op nurse preparing for surgery, just ask, I need a form so that I can apply for the free vitamins. This would only work if you have commercial insurance through your job and you have a need for B12. If you don't have a prescription need for B12, this will not work for you, okay? I would love for it to work for everyone, just not today. Other brands include Bariactive, Barimelt, Nutrametrics, and all of these things you can get online. But more importantly, there's no reason why you should not have your vitamin regimen ready by the time you have surgery, because when you come to the hospital, all of the vitamins that you need are going to be available at the Northwest Pharmacy. There's a variety of brands in there, especially these, in a variety of flavors and forms. So you're always welcome, and you may get it even cheaper at the Northwest Pharmacy. So because we have contracts with the hospital, it's not going to be the same retail price as Amazon. So I actually suggest you try to get it from the pharmacy first, unless they don't have something that you prefer. Nutrametrics. Nutrametrics has a wide variety of products. So if you are buying Nutrametrics brand calcium citrate and multivitamin, the big thing you want to look for is that it has enough thiamine in your multivitamin. Some versions of it has only 3 milligrams. Others have 12 and others have 25. So we want to make sure we're getting at least 12 for the day. So be sure, like everything else, and compare your regimen with your daily needs vitamin worksheet. Okay, now the big thing with Nutrimetrics is it is isotonic. All that means is the vitamins are already broken up into the smallest part possible and it's rapidly absorbed into your system. So within 10 minutes, it's in your blood. Boom, bam, bam, done. This is very useful if you're having poor vitamin tolerance. What does that mean? If you are having poor vitamin tolerance, it means that you're not tolerating it, or in other words, it's not staying down. You took it and your body said, tummy rejected it and it's coming back up. You're feeling nauseated, you're throwing up, you're diarrhea. Something is going wrong where your body refused to accept it. So that's when it becomes intolerant. So if you're experiencing any of those things, or maybe it just tastes so bad you can't stomach to get it down, this would be the next best substitute for you. This is going to make it easy it's just liquid, there's flavor, but it's going to absorb rapidly. You can take it really, really slowly, and it's usually it works when other vitamins do not. So it's a good backup if you feel like you typically get a lot of GI distress, gastrointestinal distress. If you feel like you have a funny stomach, that might be an option just in case things go a little sideways. And that you would only get online. There's few places that have it, and those places are listed in your binder. Dumping syndrome is the one thing we do not want to get familiar with because it is the absolute worst. So we want to make sure that we are doing what we should be doing and staying within the guidelines. What are the guidelines? Everything that you've been learning in your classes. And on top of that, you've been reading the pre-op packet and reading your binder as your first line of information. So about half of patients with bypass and less often the sleeve would get this dumping syndrome. How's it caused? Well, if you decide to be experimental and want to just enjoy some juice right out of surgery, boom, you are going to experience some of these things, if not all of these things, being extreme discomfort, and will have to, excuse me, and will have to fight for a bed in an ER where other patients with other more severe, serious illnesses, including COVID, you might have to fight for a space. So, to prevent all of that, let's not have too much sweet things all at once. So, a half cup of juice can easily put you into this situation. So, let's avoid it altogether. Let's stay within the guidelines and stay with flavored 0 calorie drinks. What does it look like? Well, as a result of the brain and the stomach freaking out because you just had surgery, you just messed with the stomach, and the stomach does not like to be messed with, and that's exactly what we did. And they need time to adjust to this new body, right? This new thing, this new change going on. But while it's adjusting, we can't rush it. So if we do rush it, we might start to get cramps, and then we rush it again, and then we have nausea, and all of a sudden we have diarrhea because the stomach's freaking out and it wants to just empty everything. And now because you've had diarrhea, now you're dehydrated because you're only losing fluids. Now you've lost so much fluid, your blood pressure is going to drop. And now your blood pressure is low, you're going to start feeling dizzy and you might fall and we don't know what's going to happen there. So one illness, one flaw can lead to something else. And you're cold sweating because all these things are happening and now your blood sugars are going crazy. So it's not fun at all. It's very uncomfortable. So let's not go there. Okay. I don't know the last person. It's been a while I've encountered someone having this because they pretty much stay within the guidelines. So the domino effect here, I kind of touched on it. If you have diarrhea, you're going to lose a lot of fluids. And with your fluids, you're not just losing water, you're losing electrolytes. And you may be familiar with that. So you're losing your vitamins. And then because you're in such a bad state, it's going to be hard for you to eat anything, drink anything, take your vitamins. So now you've opened up more risk of being vitamin deficient because nothing stays down and everything that went down is coming out in one direction or another, right? It's a whole mess. So again, let's just avoid that altogether. Now, while the main cause of dumping syndrome is a high amount of sugar all at once, you can also get it from a high amount of fats, things like bacon. You sizzle the bacon on the stove and you hear all that sizzle and crunch, two strips, and you can go downhill from there. So let's avoid it. Um, So now fat, we definitely want to manage our fat because of course, if we have too much fat, we're just going to keep gaining weight and we don't want to regain weight too soon, right? So keep in mind with your calories, if you have more calories than you need in the day, you're going to gain weight. Now, if your weight goes up by a pound or two in one day, it does not mean that you gain a pound of fat. It might be fluid and it might just be bulk from your food because you will need to eat 500 extra calories on top of what you were usually eating for a week straight just to gain 1 pound. To look at this another way, you need to eat 3,500 extra calories on top of what you usually eat to gain 1 pound of fat in one day. Okay, so we're not gaining weight every time we just see the scale go up and down by 2 pounds. That's not how this works. Okay, diet progression. Progression meaning we are going to slowly, one step at a time, start from here, then go to here and down, all the way back to nutrition for life. So we're going to begin with the juice party. The juice party is going to be your clear liquid stage. Other programs might just call it stage one. We want to be hip, so it's the juice party. Second stage or next step, we're going to go into the protein powwow where we're going to be focusing only on protein drinks. This is also known as your full liquid stage. You can't see through them and it's fairly thick. So this is your stage two. Then we have your soft pureed protein foods. So you may notice the foods are getting a little bit thicker and thicker as we go down the line. So protein foods, but they're solid, but they're really soft and pureed. Stage three. Down to stage four. And now we can have chopped foods. It's pretty whole, pretty lumpy. Doesn't have to be pureed like baby food anymore. We're getting closer and closer to a regular plate. And then we go back to the regular plate where we can have something nice and fancy, maybe something like this over here. Your nutrition for life. So let's dive in details. Your juice party should be super fun because you get to make juice cocktails. So you can have a mixture of, without the ice, you can have a mixture of flavors as long as you are having clear liquids. So the juice party is going to start from day one, your first full day home from bariatric surgery, your first post-op day one, where liquid is the priority. This is the only thing you're going to focus on for this time. Liquid is the priority. Did you say it with me? Liquid is the priority. Very good. Okay, we're going to be sipping at about 6 or 8 ounces per hour. So we're looking at a little juice glass, for example, or if you want to keep your bigger container, that's fine. We're just kind of going to make sure we're sipping on it throughout the day. Your liquids must be clear. They must be absolutely clear. What is clear? It means I can put a page with some writing on it on the other side of the glass and I can still read it. That is clear. These liquids will have absolutely no added sugar, absolutely no caffeine. and absolutely no bubbles. No added sugar, no caffeine, no bubbles, all right? So these clear liquids, this is how you're going to make your juice cocktail. Yay, how to make a cocktail. We're going to mix equal parts. Half of it is going to be your clear 100% juice, and half of it is going to be water. Isn't that simple? And you can take your juice cocktail and you can mix different ones together and make nice, pretty cocktails and have fun with it without the ice, no ice. So we're going to make 48 ounces of this, and that's how much we're going to drink per day, absolute minimum. So of these 48 ounces, 24 is 100% clear juice and 24 is water. So you can make a pitcher if you want, and you can have a pitcher of apple, a pitcher of pear flavor. You can mix two pitchers together, but make your pitchers and make sure you finish it. It's going to take some time, but you will. Some examples of clear juices: apple, white grape, cranberry, and pear. If you see another one that's absolutely clear, just like these, that is okay. If you cannot see through it, something like tomato and orange, that is absolutely not clear and that will not be permissible. You're asking for drama. None of these things, that is drama. Now, what happens if you're still thirsty and you want some more liquids? Sure, let's look at that. We can have low-calorie fluids, but first and foremost, we need to make sure we're getting 48 ounces of our juice cocktail. Once we have had our 48 ounces of clear juice cocktail, we can have some broths. We can have some decaf tea. We can even have some sugar-free jello, and you can throw it in the middle of your day, and that's okay, as long as at the end of the day you meet your cocktail requirement. You can have a diet Snapple iced tea with zero added sugar, right? Flavored water with Mio, Chrysolite, all those fun things that you've gotten accustomed to. You're welcome to keep those in there. G2 Gatorade, get your favorite flavors. You have a variety of things. You don't need to get bored. I suggest if you like excitement in your taste buds, maybe have a couple different ones on hand. Just in case one doesn't work, we can have something else. I don't want to get too bored with one thing. We talked about no added sugar at least 3 times. Did you say it with me? No added sugar. The next thing, no straws. Why? Because we're going to inhale some air. And you may think, it's not a big deal. But that air is going to get trapped in your stomach. And you're not going to feel it until it pools with the other bubbles of air in your stomach. It'll become one big bubble, and then it's going to hurt. And it's going to be like gas pain. If you've ever had gas pain, think about it times 10. That's what I've heard. That's how it's described to me. And then carbonation, no bubbles. Bubbles is carbonation, no fizzy stuff, no champagne-like stuff. We're just going to enjoy it flat. Okay? So these are guidelines. All right, now once you're done with 3 days of drinking nice half and half juice cocktails, it comes to an end. It is over. The party can only go for so long. So you abruptly stop that party and you reintroduce or you introduce the next stage, the protein powwow, different kind of celebration. So we're going to have full liquid through here where you cannot read through it. It is not clear, and that's okay. So most of these protein shakes tend to be on the milky side. But again, there's other things we can do. So juice party ends. That's the most important part. Now you're having protein shakes all day. That's all we're focusing on is protein shakes. You're going to make your own protein shakes, and they do not count as fluid. Say it with me. Protein shakes do not count as fluid. Very good. Okay. You're going to make your own little protein powwow shake. You're going to take maybe 6 or 7 ounces of water. Now you can use milk to get some more calories and to get some more protein in there, but we can start with water just to make sure things are tolerating okay. And you're going to put at least 20 grams of whey protein in there. It must be whey protein isolate. Whey protein isolate. Other forms of protein, are they bad? No, it's just that you may not absorb as much of it. And this is already going to be a challenge for you. So let's make sure whatever we do get down, let's make sure it counts. 100% counts. So please stick to the whey protein isolate. And these nice little protein powwows, we're going to have maybe four of them. It's going to be challenging in the beginning. In the beginning, you might get three, and that's okay. But we're going to work our way up to four and work our way up to five eventually. So if we have this little 6 ounce, time you add the shake, the protein in there, it's going to be maybe 7 or 8 ounces or nine if you use that 8 ounces of base. And you did that 3 times, that's going to be 60 grams of protein. For women, that's okay. For men, you got to get four because you got to aim for that 80 grams as a bare minimum. So how do we make sure we're getting the biggest bang for our punch? Well, instead of using just water, you can use 6 ounces of milk. And in that 6 ounces of milk, you're going to get an additional 6 grams of protein. So instead of a 20-gram protein drink, you're going to get a 26-gram protein drink. And that way, if you did it 3 times, you're even closer to where you should be with your protein goals. So if you're not going to use cow's milk, that's okay. You can use soy milk. You're going to get the same amount of protein with soy milk. If you're going to use another plant-based milk, you are not going to get the same amount of protein unless it's specifically fortified. What does that mean? Cashew milk, oat milk, rice milk, these milks are not high sources of protein. They typically have maybe 1 or 2 grams per glass. But because of the demand of protein, some brands, such as Silk, might say you can get this coconut cashew milk, but it has added protein in there, and one glass has 10 grams. In those cases, sure, but otherwise, no. You can have it just for the taste, but it's not going to add more protein to it. Now, when you're having your protein shake, you're going to stop drinking at 30 minutes. That means you need to watch the time and see when you started to drink in the first place. So look at the clock, look at your watch, look at your phone. I'm starting my meal at X time. 30 minutes down the road, I should be done. If that 30 minutes comes by and you're still drinking, you need to stop. Stop drinking after 30 minutes, okay? Do not continue, do not force yourself. Now, if we're having, not if, because we are having our shakes and we're still having our fluids throughout the day because we need to get our 48 ounces of fluid every single day forever and ever and ever, ever, okay? Say it with me. I must have 48 ounces of low calorie fluid every day. That does not change ever. So you're going to have your 48 ounces of fluid and your 3 or 4 protein shakes. Okay. Moving on, pureed foods. We're on to stage 3, your pureed foods. This is going to be the second 2 weeks post-op, so days 15 through days 30. All foods must be soft, moist, mushy or blended. So this looks like um, applesauce, even like a pancake batter mix. That's how soft and mushy it must be. If you're going to be experimental and overlook these guidelines, I assure you, your stomach would let you know it's not the right move. Always, even if it's soft and mushy, still spend some time chewing that food very well. Make sure all the lumps are dissolved. And this food, once you're pureeing your meats and whatnot, we're going to get to some examples. The most you're going to have at once is about 2 ounces. So if you put 2 fingers together from the tip of the finger to your knuckles, that's how much food it's going to be, like 3 or 4 tablespoons, really small. And the only thing we are eating at this time is high protein foods. What are high protein foods? I'm glad you asked. Well, an easy way to think about it is as long as it was alive and it could look at you, so it wasn't alive and it had eyes, things that run, hop, jump, skip, drive, fly, so birds, anything that any animal walking on land. I mean, if you're into crickets, that's on you, that's okay. It hops, it has eyes and it can look at you. It's a great source of protein. Okay, fish in the sea, they got eyes. Anything out of the sea with eyes would work. Have good sources of protein. Okay, and then you have a nice list in your binder. Don't forget to use the resources that you already have. Okay. All right, so let's dive into this pureed blended stage. We're going to have a little tiny bite using a baby spoon every 3 or 5 minutes. That's how slow we're going. And just as before, we're going to look at the time and make sure we stop at the 30-minute mark. Now, shakes are meals and blended protein foods are meals. The fluids are not meals. Fluids are fluids and food are food. And we're going to make sure we separate them by at least 30 minutes. So if I start eating at 12, I'm stopping at 12:30, and I'm not going to have something to drink or eat, whichever one I did before. I'm going to have the other one by about 1 o'clock. So I'm looking at the time until you get used to that. Now, when you're going into your protein blended pureed stage, you're not going to just dive in on everything harsh. You can take your time and transition. So the first week, start off nice and slow, days 15 through 21. Start with nice soft yogurt, cottage cheese, if you're doing applesauce, this applesauce is with protein powder. So your base of your applesauce is just enough to make sure you have something to mix in with the protein powder. And now it's going to be like a really thick paste. And that's what you want. You can have scrambled eggs and you can soften it with some milk, or you can have some kefir. Great sources, great places to start. And once those things work very well, week two, then we can start slipping in some tuna. Now you can try these things in the first week, but I suggest starting here first, making sure it's safe, and then proceeding to these canned foods that are high sources of protein. Now, what are some things we can slowly add to our protein foods? Really, really small. You can do a well-cooked, skinless, really soft veggie like zucchini. You see how it kind of melts in the pan, but you got to peel the skin. Or a soft squash, like those greens, those yellow squash, it just kind of melts. Or eggplant, and it's really soft and mushy in the center. You can add like 1 tablespoon into your meats and in your second week, and that'll be pretty good. Spinach, you can blend the spinach and add it to your food to moisten it. That's perfectly fine. Or you can even do some things like condiments, like the yogurt and the cheeses, mayo, a little mustard or hummus, any one of these things. 1 to 2 teaspoons into, because you're only having like 2 ounces of meat. And time you mix in a little bit of this, even then it might be still much for you. So take your time and work your way. What we're not going to have is no fresh vegetables. Say it with me. No fresh vegetables, no whole fruit, no seeds, and no nuts. None of these things. Huge red flags. We're going to pay attention to your protein goal, 60 to 80 grams for women and 80 to 100 grams for men, until I meet with you 1 month post-op and give you your update on that. Keep this screenshot for when you're just going through the day until you get used to it. As you go through the stages, you're not going to go hard and no hard start and stops, meaning from the first stage, from the clear liquids, that's the only time we hard stop, and then we move into your protein shakes. Every other time, you can slowly ease into it. You can keep doing protein shakes and slowly introduce one soft protein food. So that day might look like 2 shakes and 2 protein dishes. Okay, now as you slowly reduce the thinner foods from your liquids, like not fluids, your liquid, like your liquid protein shake, and you have a whole protein meal instead, then you add more thicker foods, right? Always, we're going to eat the protein first. That's never going to change. That's just going to keep us in check for a couple of reasons. It's going to take longer for the food to digest. We can take our time and make sure we prioritize getting our protein needs met. Then we can have the other things on the plate, preferably the veggie, and keep the fruit or the starch for last. We're slowly going to have maybe 1 or 2 shakes a day over time. And once you've really mastered getting your protein needs met, you may not need any shakes at all. You might just have it for convenience on occasion. It's good to have flavorless protein powder on hand, just like you want to add it to anything. You can add it to starchy foods in future or even at this stage to make sure that you're enjoying foods, but you're meeting your protein needs. And during this time, you want to limit the exciting spices like chicken, tacos, spicy Mexican, Southern grill, all of these things, just until your stomach has adapted to all these new things. You don't want to put too many new variations at once. You want to ease into it. And then at 1 month post-op, you should be meeting with your dietitian and your nurse practitioner to see how things are going. Common side effects post-op. Dehydration is the #1 reason you're going to end up in the ER. So let's make sure, like we've done before, say it with me, I must have 48 ounces of fluids on top of my protein every single day, okay? So let's prevent that. These things, we have ways to troubleshoot them, and they were covered in the pre-op class. So if you want to review that, and also if you feel like things are really, you're having a tough time, please call the office. If you send me an email, I may not see it, I may be on vacation. If you really feel like you're struggling a lot, call the office. You're likely to get a visit with Rebecca, the nurse practitioner, likely within a couple days, possibly the same day, but do let us know. An email is not the best way to communicate when you are struggling. And if you're like most patients, at 1 month, everything has gone fine, you're doing well, you've seen some weight loss, you had no GI drama, you stayed within the guidelines, and you're doing fairly well. Now, after you've seen the dietitian and the nurse practitioner 1 month post-op, now you're going to enter into the fourth stage here, the second and third month, days 31 through 90, where your foods can be soft but chopped. So instead of baby food, pureed foods, you can now have things that are more visibly appealing on your plate, and you can have 2 or 3 things on there if you wanted to. So you can have meats, but it should be chopped and it should be cooked well and soft, so moist, well done, preferably, or medium well. You're going to avoid having undercooked meats, and that includes all variations of this. And again, you still want it moist in some way, so use condiments where necessary. Your frozen vegetables, your fresh vegetables should be cooked. So it can be cooked. We're not going to have just raw vegetables at this time. So make sure and cook them. We're going to avoid the skins of most vegetables. I say most because something like broccoli or has a wooden structure. That broccoli and that cauliflower has a wooden structure, so we're not going to have that woody part. You can cut off just the florets to the top and cook it until it's mushy. That would be okay. Nuts and seeds, still a no-no at this time. Regular skins, no-no. So your frozen vegetables usually come either in really small bits, and because of how it's frozen, when you cook it, it's usually going to be tolerable, but still avoid things that have tough skins. You can have low fat cheeses. Low fat meaning you're basically going to look on the label and pick the cheeses that have more protein than fat. So this is a short list here, and you can just look on the label in the grocery for others. You're welcome to start having a little bit of fruit, just a little bit, 1 serving, but they need to be canned. So we're not biting into any apples or biting into any bananas just yet. So canned fruits, you're going to drain the fluid and make sure there's no added sugar in the can. The most amount that you're having at this time is anywhere from a quarter cup, which is about 2 ounces, to 3/4 of a cup, which is about 6 ounces, which is smaller than your fist. So if you're having a fist of something, you're having too much. So let's dial it back a little bit and keep the volume small. Continue separating your food and drink by at least 30 minutes and maintain your 48-ounce minimum of fluids. For my men or taller women that are 6 foot and above, make sure you're getting your 64 ounces of fluids every single day. Your protein goals, at this point, you will know what your individual protein goal is, and we really got to make an effort to hit those numbers at least most of the days of the week to make sure we are in good compliance with our lab work and in good health. At this point, 3 months post-op, you will meet with the RD one last time before annual visits, and we will make sure everything is okay. You'll have an opportunity. Your RD is your dietitian. You would have the opportunity to ask any questions, clarify anything, any adjustments that need to be made, review your lab work, make sure things are doing really well for you, and then you can progress to nutrition for life. And those are the same guidelines that you have started with in the beginning, and you have now would have access to a pre-recorded version of that webinar at your convenience. As always, review your pre-op packet for details. Always call the nurse practitioner if you have any type of drama going on, things are really bad, and feel free to ask questions via email. Thank you for watching. Have a great day.